Good morning, Chris Hull, Wake Forest University School of Medicine, Infectious Diseases, here to talk about all sorts of viruses. And we'll start out with respiratory viruses. Interesting season so far this year, because it's just barely into November. Still haven't picked up the pumpkins from the front porch. And we're starting to see respiratory viruses that we usually don't see until late December, January and February. So 3 weeks ago, I mentioned, I think it was 3 weeks ago I was here, I mentioned that we really hadn't started to see much flu in the area yet. Usually when I say something like that, it jinxes me. And that afternoon, I actually got a report that over the 3 days prior to our last chat, cases were starting to go up. So we kept an eye on that, and they continued to go up. And affecting our triad community here in particular, but also all throughout North Carolina, in fact, all throughout the country. School absenteeism is high right now. In fact, if you have kids in school, you probably know that. It's actually affected a few high school football teams because of flu getting and affecting their players. And it's really going through the schools. Most of the flu is influenza A. Most of it is an H1N1 type of A. But since we've been seeing these increase in cases, we're now starting to see more cases also in the hospital. Because people who are at the extremes of age, in particular the elderly and those with underlying health problems, particularly with underlying lung diseases, when they get influenza, they can get exacerbations of the underlying lung disease, and they end up getting in the hospital. Particularly, we're seeing flu in kids right now. Some of this reflects school-wide transmission, but it also reflects, I think, a bit reduced vaccination rates for influenza. Over the last couple of years, people have kind of gotten lax on flu because COVID's been demanding the attention. Our children's hospitals are getting pretty busy. It's not just flu, unfortunately. Another virus called, we'll just abbreviate it, RSV, stands for respiratory syncytial virus. I don't think you need to remember that. If you do just RSV, you'll be okay. So this is a virus that in most of us causes mild colds. A little bit of a runny nose, stuffy nose, maybe a bit of a sore throat, maybe a bit of a cough. And then it goes away in 4 to 5 days. But in the little tiny kids, so children particularly under the age of 1, RSV can be a very serious infection. And the reason why it's so serious in kids under 1 is this virus affects mostly our airways, those tubes that come from the back of our throat down into the lung and branch out to all the different parts of the lungs. So those tubes in us adults, when we get it, they're big enough and the inflammation doesn't really compromise the size of the tube. But the little tiny babies, they have very, very small tubes. And so if they get inflammation from that virus, those tubes get narrow. And it makes it harder for the baby to breathe, and then they get pneumonia. And then they end up in the hospital. And RSV is a significant cause of hospitalization for young children, those under the age of 2 or so, usually during the winter months. But this year we're seeing it now. And we're also seeing a lot more other cold viruses going around. I won't go through all of the names, but it's cold and flu season now. So why is that the case? Well, it's kind of interesting. Throughout COVID, we've seen disruptions in how our usual cold and flu viruses transmit. Usually when COVID dominates, the other viruses are they lay low. They don't like the competition, I guess. And so we haven't seen as much of these other viruses over the last 2 to 3 years. Usually with a lot of these types of cold and flu viruses, getting infected periodically over time, every year, maybe every other year you get a cold, and it increases your immunity, beefs it up a little bit, tops off your tank immunologically, and that keeps you from getting more serious infections. And we haven't had that over the last couple, 3 years. So these viruses are taking advantage, I think, of a reduced population-based immunity to RSV and such. Influenza is one that usually comes up in the latter part of December, and then we deal with it January through February, and then it starts to go away with March. It's going to be a little interesting to see how that goes this year, and whether or not we have. There's 3 different scenarios you can imagine. One is that we have this kind of big surge of influenza now, and then it tapers off, and then the January, February peaks aren't as high because we went through it. The other possible scenario is it just keeps going, and it continues to be a bugaboo throughout the whole winter season. And flu sometimes can do that by shifting around and changing itself immunologically. And so we'll have to see which one of those comes up. What about COVID in this mix? COVID's now one of our respiratory viruses, and we still are seeing COVID. Interestingly, the number of cases that we're recording and the number that we're seeing with wastewater monitoring and the number of hospitalizations that we're seeing with COVID is kind of at a nadir, at a low point compared to what it had been in the past. So it's like these other viruses are sort of taking advantage of that and are coming up now. In the world of COVID, though, there's some shifting going on. We're starting to see some new variants. Right now, BA.5 is still the predominant variant here in the triad, but a lot of us have gotten BA.5 or through boosting are immune to BA.5, and so there are some other variants starting to take over slowly but surely, and these include, you ready for the number, potpourri alphabet soup, B1, B1.1, QX, QXB, and we're starting to see these get some traction here in North Carolina. Interestingly, these other variants, all of which are prodigy or sons and daughters of the Omicron variant, are not taking off quite as fast as BA4 and 5 did last summer. BA4 and 5 went up fairly quickly. These are going up a little bit more slowly. And they get their traction because they're a little bit more transmissible than BA4 and 5. They don't appear to be any more severe, and that's good news. But they may evade pre-existing immunity a bit more, which means that if you got COVID early in the pandemic, or you got Delta last year, or even if you've got Omicron last January and February when we had that big surge, you might get it again. But pre-existing immunity seems to help protect us from serious infection due to COVID, including hospitalization and death. But you might get a COVID cold. So slowly, as time goes on, it seems like these new variants basically are entering into our respiratory viral potpourri for the season. My prediction is that as we get into the latter part of December and into January and February, some of these other viruses will get pushed down again, and that COVID will become the predominant respiratory virus that we see. That's just a prediction, and no one really knows for sure. But as these other variants get more traction and evade immunity more, they're going to be a lot more susceptible people to getting COVID. Hopefully, most of these COVID infections will be minor, COVID colds, but they're still disruptive, right? They keep you home from work, they keep you home from school. Still have to isolate for 5 days, which we're still doing for COVID. So when COVID gets into your family, it can be kind of a topsy-turvy couple weeks trying to do the usual activities that you want to do. Also, for the elderly, people at the extremes of age, and people who have serious underlying health problems, getting COVID is still serious. It still pops you in the hospital. And deaths due to COVID are still happening. We're still seeing here in Forsyth County roughly 1 a week due to COVID. So it hasn't totally gone away. Now, a few practical things about our early respiratory viral season. Our hospitals are busy. Our emergency departments are especially busy. And so all of our health systems in the triad are asking people to think about it before presenting for medical care. Now, if you have a baby under the age of 2 or so, and that baby gets sick, and they seem to be having a lot more trouble sleeping and or breathing, yes, by all means, you should go to the emergency department. That's an emergency. But otherwise, if you have a fever and body aches and a headache and a bit of a sore throat and a bit of a cough, right now, it's probably the flu. And you can call your primary care physician and talk about whether or not you would like a prescription for an antiviral. Most are familiar with Tamiflu, but there are others as well. And that sometimes, if taken early, within the first 48 hours of symptoms of the flu, can help you feel better faster and reduce viral shedding a bit faster, which means you're not as contagious as long. Get you back to work, if that's what you want to do. Sometimes people would just rather have that Friday off, but so you can talk to your primary care physician. Another option, rather than going to the emergency department, would be urgent care. Here in Wake Forest Baptist Health, we have some new urgent cares up, one of which is in Kernersville, that you can get and find out all about on our website, or go to My Wake Health and find out where that is and what its hours are, which is very convenient because it's 24 hours a day, pretty easy to remember. And then we have the Pisgah Church urgent care, and then our other urgent cares and family medicine clinics that have been here over the years. And I'm sure all of the other health systems would also prefer that you try to stay out of the emergency department and use some of these other primary care services. If you have a cold otherwise, and it's just a cold, you probably don't need to see anybody. In fact, a lot of people, even when they get the flu, just write it out. But if you have underlying medical problems or at the extremes of age, the little babies or the elderly, those are the times when you're going to want to get health care looked at, preferably through primary care. The other thing that's a little bit practical now is, since we have 3 viruses circulating at least, when you get sick, get a bit of sore throat, you get a stuffy nose, maybe you take your temperature, it's 100.1. Is it the flu? Is it COVID? Or is it some other virus? So here's a few pointers to help sort that out. First of all, let's figure out if it's COVID, because COVID, if you have that, you're out for 5 days. You have to isolate. And you may want to let your contacts know that you have COVID so that they can test for COVID also, and particularly if they get ill as well. How do you do that? The best way to do that is with a home test. Home tests are still available with all our major pharmacies and other outlets. You can order them online. Unfortunately, the federal government's not paying for them anymore. But there are still tests out there that you can get. There also are You can get tested if you go to one of the urgent cares that we just talked about. They will usually test you for COVID and flu and RSV sometimes all at the same time. We have one test that does all three. So you figure out first if you have COVID. Now, if the COVID test is negative and 2 days later you're still feeling kind of ill, in that interim, you want to stay home, be a good citizen. Let's not give our viruses to other people. So stay home from school or work for a couple days. Test again for COVID 48 hours after the first one. And if that one is negative and you're starting to feel better, you can go back to school. You can go back to work, but wear a mask for a while and keep your virus to yourself. And the masks still do that. Now, if you have a fever with it, and you generally, with the flu, your fever is over 100.5 or 101. If you have a fever with it, body aches and a headache, it's probably the flu. And then again, if you have underlying medical problems or older, give your doc a call and see if you want what they think about a prescription for Tamiflu. If you have influenza, you should stay home as long as you have a fever. Once you have no fever for 24 hours after having the flu, then you can go back to work. And so it's a 24-hour, no fever, you can go back to work or school. Unfortunately, the fever with the flu, particularly this year, seems to be lasting 3 to 4 days. So you're kind of out for a week if you get the flu. So if it's not the flu and if it's not COVID, then it's one of these other viruses. You have a cold. Stay home during the peak of it. Eat a lot of chicken soup. Get some rest. Drink lots of fluids. And as soon as you start to feel better, come back to work or school, but wearing a mask until your symptoms are completely gone. So I think that's a little bit of a guideline what to do to help you get through the early cold and flu season we have this year. A few other things going on. Very exciting news this week about vaccination for RSV. So we have been working on RSV vaccines for a long time because RSV in children under the age of 2, particularly those under the age of 1, often will land them in the hospital. And sometimes there's deaths. And so we've really wanted a good vaccine for RSV for years. We finally have gotten some traction on that. And it looks like we have a vaccine that works pretty well. But the place where it works the best is in the mom. So you might say, well, how does immunizing mom help the baby? Well, what you do is you immunize mom for RSV while they're pregnant. Mom then fires up the immune system, makes IgG antibodies in response to the vaccine. IgG is a type of antibody that can cross the placenta, and then off it goes to baby, and it protects baby for the first 3 to 6 months of its life. And so the big study was done, international study, using Pfizer's RSV vaccine. And such a vaccine strategy of immunizing pregnant women, about 80% reduction in RSV infections in babies. That's huge. That's a big deal. I would suspect that within a year, RSV vaccination will become routine for all pregnant women. Just like we give diphtheria, tetanus, and pertussis, whooping cough vaccine to all pregnant women. Why do we do that? It's to protect the baby in the same way, because babies who get whooping cough have a big problem. So I think RSV vaccine will enter into our routine maternal vaccination series. So we're real excited about that in infectious diseases. A little bit about Ebola. So Ebola is still out there. We talked about it a little bit 3 weeks ago in central Uganda. The number of cases of Ebola are not increasing, but they're also not going down in Uganda very quickly. And unfortunately, it spread from the more rural districts into Kampala. Kampala is the capital city of Uganda, big city, millions of people. And it's a little bit harder to contain and track down than Ebola in large urban centers. So the Uganda government and the WHO and other NGOs, including the CDC, are working to try to keep it contained there. Like I said, the good news is unlike the Western Africa Ebola outbreak that we had a few years back, we don't see that explosive increase in cases. It's just kind of sputtering along. I suspect it'll eventually get contained. Could it enter the United States? Possibly. If you remember the last Western Africa outbreak, we had a few cases come to the U.S. It wasn't a huge number, less than a handful, but it kind of got people excited. And so what we're doing right now is anybody who's been in Uganda, their flights are all being taken in at one of 5 or 6 airports here in the United States, the major quarantine airports. You can imagine what they are: JFK, Newark, Chicago, so on and so forth. And then people are being checked for Ebola, monitored for their health, told what to do, and then they are, when they go to their home, the state health department, here in North Carolina anyway, it'll be the state health department, keeps track of them, gives them a phone call. How you feeling? How you doing? Glad you're doing well. Talk to you again tomorrow. And we do that for 21 days. And if those people get sick, then they'll go to one of a handful of Ebola assessment centers. So here in North Carolina, we have a Ebola assessment center. Here in the Triad, Atrium Health, Wake Forest Baptist is the assessment center for our Triad area here for Ebola. Should somebody return and get sick and we need to sort out whether or not they have it. Will it actually happen? I think it's unlikely. Is it a major problem that people should be worrying about? No, I don't think so. I think more likely than not it'll get contained in Uganda. The other brightness in the Ebola world is that this particular strain of Ebola, Ebola Sudan, there's 3 vaccine candidates that they'll be starting to test in Uganda here in the next few weeks. And if those vaccines work, which they should, then we'll have a way to help contain that infection there. So with that, I'll go ahead and open it up for questions. If there are any.
So we have seen that 11 more people have died of COVID-related deaths in Forsyth County. I think it was in the past week, the state's weekly report, which said it was the second highest count since the Omicron surge in mid-February. So I know you had mentioned that cases are kind of at a standstill for COVID you're seeing, but should we be worried? Are they more fatal cases, or what's going on?
Yeah, so yeah, we had a bit of a peak in deaths here in Forsyth County over the last couple weeks. But the cases, our hospitalization numbers, at least within Atrium Health, Wake Forest Baptist, are the lowest it's been since January. So what happens is when you have a serious case of COVID that gets admitted to the hospital, the average hospital stay is 3 weeks, I think, somewhere in that time frame. And some of them are longer. And so what happens is you have people who've been sick with COVID for a while. In fact, a lot of them don't even have the virus anymore. They just have the underlying destruction of the lungs and other organs. And then they die later. And so you can get these kind of ups and downs in death rates. So we're not seeing more serious COVID. The meanness or the virulence of the BA4 and 5 variants is no different than what it was. It's not a Delta, so that's good news. So you're going to see these variations kind of with time, over time, but it's really not any different.
With us just coming off of Halloween, our numbers for, I guess, I saw 3 of these viruses. Do you expect or anticipate those will increase in the coming days coming off of Halloween?
Yeah.
And how should people handle just going into the holiday season?
Right, yeah, it's a good question because we're getting close to the holidays. So what about Halloween? So, if you wanted to get viruses to circulate amongst people, what you would do is have a fairly large, crowded indoor Halloween party. And luckily the weather was kind of nice this year, so maybe more people were outside. But yeah, we might see more. Unlike in the earlier days of the pandemic when we used to watch the numbers really carefully, we could really see how infections followed holidays. I don't know if we'll see that this year. Where the transmission engine right now in our communities really is in the schools. And the kids are spreading it amongst each other. And it's not just respiratory virus. There's also that norovirus, the 24-hour vomiting one, which people abhor just as much as the other ones. That's going through the schools right now too. So, and then the kids bring it home. So that's the major engine right now. One thing that's different this year than last year at this time is our schools they're not wearing masks. Last year, most of them, at least in the triad, were masked. And masks will reduce transmission of all of these viruses, not just COVID. So what about going into Thanksgiving? I think I really would like to not have what we did in the last 1 or 2 years, like cancel holidays mostly, or I think it's important for people to get together. We've really learned that, families, friends, and such. But let's just use a few practical pointers, and that is, if you're sick, be a good citizen and sit it out. Pop in virtually or something, or if you've been exposed to COVID or you test before you go, which you can do. You can test daily if you want, and wear a mask when you're there. Take it off for dinner, but so you can. There's ways to still enjoy getting together for the holidays, and do it sort of in a practical way, in a safe way. And I don't know about you, but in past holidays, there are maybe some memories there of Uncle Eddie who came with a horrible cold and showed up at Thanksgiving. I mean, that's a little bit rude. So it's probably best not to do that. For COVID, flu, RSV, what have you. If you're sick, stay home. The other thing, and we haven't mentioned it, is before the holidays come up, go out and get the fall COVID booster and get your flu shot. The flu shot seems to be fairly well targeted for the flu so far, from what we know this year. So if you get your flu shot, you're much less likely to get the flu, and if you do, it won't be nearly as nasty, and you won't have it as long. Same thing with the fall COVID booster. Luckily, those new variants I talked about, 1 and 1.1, and the BFs and the XBs, and they all seem to be fairly well covered by the fall booster. Just a little bit less, but enough to keep you out of trouble. So that fall booster is Omicron specific. It's BA4 and 5, and also these sons of BA4 and 5 that we're seeing now. So get your fall booster, and you're much more likely to have an illness-free holiday time, and that's good for everybody.
We have a couple questions on our chat. Barbara's asking, did you say there is an RSV vaccine now for pregnant women? If so, is there a time frame of receiving the shot before the baby is born?
Yeah, so the RSV vaccine for pregnant women, so it's not out yet. It has to go through the approval process and through the CDC process. That'll probably take a few months. This is just the results of one study. And there are a couple other studies yet to come out with this vaccine. How the timing will exactly work out for pregnancy, what it'll probably be is get it sometime before during the second early third trimester. I'm guessing, but we'll have to see what the CDC says. Because, if you get it too early, then the immunity starts to wane a little bit. Plus, we don't usually do vaccines in the first trimester. But in the second trimester, that would be a great time to get it. But you'll want to get it at least a month before delivery. And sometimes, you know how those deliveries can kind of sneak up on you and come early? So, second trimester, I'm guessing.
Pamela is talking about she got her flu shot and felt worse for several days, but says she's always gotten the flu shot and never has had it made her feel bad before.
Yeah, so sometimes following a flu shot, you can get a little bit of soreness at the vaccine site. And it usually doesn't last more than a day, and it's not as much soreness as you get with the COVID shot. So if you were like me and got COVID booster and the flu shot at the same time, I could tell the difference as to which one was which. The thing is that, people say, oh, I always get flu from the flu shot, or the flu shot makes me sick. And the reality of that, and we know this now from decades of experience, is that what happens is that people get one of the other colds that are circulating at this time frame, and that's what's making them feel bad. But the flu shot gets blamed, when in reality it's something else. So the flu shots are all inactivated, so there's no live virus in it. So you can't get flu from the flu shot because that antigen, that what you get is deader than a doornail, and so you can't get flu from it.
Dr. Roll, if you had an infection of the BA.5 variant in the summer, do you still have antibody protection, or should you get the fall booster?
If you had BA.5 this past summer, yeah, I'd get the fall booster. Yeah, it'll top you off immunologically for the holiday season and for the winter. I really think everyone should go. Anyone over the age of 5 should go out and get the fall booster. I mean, the only two caveats is if you've had a booster of any kind in the last 2 months, then you should wait at least 2 months. If you've had COVID in the last 3 months or so, 2 to 3 months, you can wait a little while to get the booster. You can wait 3 months after you had COVID. But if it's more than 3 months ago, go get it now. And it's widely available. Both Moderna and Pfizer have boosters for kids over the age of 5 and adults. And Moderna's, their early data, Moderna's looks a little bit better, stronger than the Pfizer fall booster. Between the two, if else they have is Pfizer, I'd just take it rather than having to wait for the Moderna. All right, well, we'll see you back here in 2 weeks. That would be November 7th, and we'll talk turkey a little bit as we get closer to Thanksgiving. So, see you then.